kitty, you ready? Alright, sit. Good kitty. Oh, you dropped your treat. Alright, kitty. Alright, ready? Jump up. Good kitty.
Alright, as promised, there's my kitty doing tricks. Okay, so we're going to finish up this last video where we're going to talk about the last of the leg muscles as well as the lower leg muscles, so thigh, lower leg. So I'm going to begin where I left off, finish with the pectineus muscle. Now we're going to talk about some adductors. Alright, the first muscle we'll talk about is the adductor longus. It's going to begin on the inferior ramus of the pubis, anterior to the adductor brevis. So we're actually not going to talk about the adductor brevis. It's a very short muscle that's up this way here. Alright, but you guys should just know that it starts on the inferior ramus of the pubis. It's going to insert on the linea aspera of the femur. So if you look here, remember we've got that intratrochanteric line and it continues down the underside or backside of, or the posterior side of our femur. So that line there, and its action, since it's the adductor longus, it's going to adduct. Alright, that's a big action. It has two, so either one is fine. You can talk about the adduction or flexion at the end medial rotation of the hip. So again, it's going to pull the leg in this way and add it to the body. So adductor longus, there's actually 4 adductor muscles, and we're only going to talk about a few of those. The adductor longus, we talk about this one because it's the easiest one to see on the cat because it's the largest and the longest one. The next one, so adductor longus is the longest one. Adductor magnus is the biggest one. So adductor, again, its action is going to be adduction at the hip. You can also say the superior portion produces flexion and inferior portion is extension. All of those deal with partially the knee and partially with and mostly with the hip. So again, I would say adductor magnus, again, large, wide muscle, starts on the inferior ramus of the pubis, posterior to adductor brevis. Again, you can ignore this part. Just focus on anterior ramus of the pubis. And its insertion, again, along the linea aspera on the back of the femur. So again, intratrochanteric line, it continues down this way, and you've got the adductor magnus. All right, so adductor magnus. So you've got the adductor longus, which is up. If we look back at our picture, all right, it's going to be a little bit higher up. All right, it's going to start here. Continue down this way. Adductor magnus is this large one. Adductor longus is going to be up here. So again, if it's an adductor muscle, its action is going to be adduction. Another muscle that you guys need to know is the rectus femoris. It's one of the very large muscles that's along the front. Okay, it's actually going down to the knee. It's part of the patella, and its main job is to allow for extension. So when you do leg extensions, when you're like sticking your legs straight out, if you're sitting down right now, just take your knees, bend them forward, bring your feet up. That's extension at the knee, and that's flexing and causing action to occur at your rectus femoris. So rectus muscles are long and flat. Femoris refers to the femur. It's going to begin on the anterior surface of the iliac spine and superior acetabular rim of the ilium. So you can say, it's okay with me if you just say inferior iliac spine, but again, you've got a posterior and anterior, so I'd prefer anterior for full points, and then superior acetabular rim of the ilium. So both of those are part of the origin. So it's going to go up. Again, acetabulum, remember, is the space that's going to be on the underside here of your femur muscle. Or of your pelvic bone. And then insertion tibial tuberosity by way of the patellar ligament. So like before, you can forget patellar ligament. Tibial tuberosity is fine. So if you look here, remember tibial tuberosity is that knot right on the front of your forearm, foreleg. So that is your tibial tuberosity. So that extension at the knee is its main function. All right, vastus muscle. So we have a couple of those. The vastus medialis. So the medialis means it's on the medial side of the body, and it's going to run the entire length. So vastus muscles are very large. So with the vastus medialis, this muscle, I just remember where it is because when you look at bodybuilders, it's like the first muscle that pops out in their leg. It's like really oftentimes huge and creepy looking, but there you go. So vastus medialis on the medial side. Its origin, entire length of the linea aspera, so it belongs around here, right? Your adductor muscles go directly behind it. and they all attach at the same point, and it's going to insert on the tibial tuberosity, again, by way of the patellar ligament. You don't need to know that, and its action is extension at the knee. So again, those guys that do those leg lifts, so you got your knee here, your foot, all right, when you bring it up and you extend your leg, so here's your knee and here's your foot, you're working out this muscle right here. So that's why it looks pretty big in the guys, so they do a lot of squats and do a lot of flexors and that extension, so that's why those muscles get big. Semimembranosus, so again, these muscles right here, you've got the semimembranosus, and we talked about the tendinosus. So these two muscles right here, again, it's going to start up here, go down to the underside. Membranosus is a long muscle. It's going to begin on the ischial tuberosity, so in the back, and it kind of comes around to the medial side on the back, and it's going to stick to the posterior surface of the medial condyle of the tibia. It's going to flex the knee, extension, and medial rotation at the hip. Okay, so those are the last of the thigh muscles. All right, now we're going to talk about 4 muscles that are in the lower leg. So think below the knee. That's what these muscles are. And these are our last 4 muscles we're going to talk about in these videos. All right, so these 4 muscles, we're talking about them because they're very large and they're pretty easy to see, even on the cat with dissection. So we're going to look at these. They're really important for a lot of function, a lot of motion, a lot of movement. So without these muscles, your legs wouldn't do what they need to do. So the first muscle is your gastrocnemius. So right here, it's identified. So this is your calf, all right? These are your calf muscles. So the gastrocnemius is part of a 2-part muscle system that works on the back of your leg. The gastrocnemius, you can find it because it's got, you know, your 2 parts right here of the calf, and it goes all the way down to the calcaneus. So it's going to begin on the femoral condyle. So by saying femoral condyles, again, this is on the distal part of the femur. Right, so very far away from the center of the body, and it's going to insert on the calcaneus by way of calcaneal tendon. So think of your Achilles tendon. That is what it's talking about right here. When you're talking about the calcaneus with the gastrocnemius, you can just say calcaneus. That's fine. If you say calcaneal tendon, I will take it because it inserts technically by way of that tendon. But again, it's that case like the patellar one. You can go ahead and forget it because it's not going to really matter. Just remember calcaneus. So it goes around the back. Remember calcaneus or calcanea tuberi, right? It's going to be that bone in the foot. Its main action is plantar flexion of the ankle. So remember plantar flexion, if you've got your leg like this, plantar flexion is where you're going to be pulling it up this way, and dorsiflexion. So those are your 2 actions. So it's moving your foot in this way. So plantar flexion, you're pointing. So inversion and adduction at the foot. So again, that's movement there. And then it also assists with flexion at the knee. So it's actually pulling on the back. Since it's on the femoral condyles, it can actually help move your leg. So the gastrocnemius. So how I remember the gastrocnemius, and the next one, the soleus. The soleus is deep to the gastrocnemius. I spelled that wrong, but that's okay. So it's deep to the gastrocnemius. With this, I remember that the soleus, all right, this is the one that does the work. This is the workhorse of your leg. All right, the gastrocnemius is for show. All right, this is what you see. Soleus does the work. Okay, so this is the workhorse. So with this muscle, it's going to begin. So the head and proximal shaft of the fibula. So this should be shaft, not shift. Fibula and adjacent shaft of the tibia. So it's going to start up here on the posterior part of the fibula, and it goes around this way to the tibia. It's going to insert on the calcaneus by way of the calcaneal tendon. So again, it's going to go to your Achilles tendon. Again, calcaneus is fine. You can say calcaneal tendon, and I'll take it for points. But again, you want calcaneus. That's the best way to describe it. Its action, again, plantar flexion at the ankle and adduction at the foot. Okay, so that's why when people are doing workouts for this muscle, if you have a person who is standing here with their legs and they want to work out their calf muscles, they will flex at the foot. So you got your leg here. If you're flat, if you put weight and you push down this way and then you work upward like this, this is going to work out these calf muscles. So calf raises, calf lifts, those are all things that pull and lift up those muscles. All right, the last 2 muscles. First one, extensor digitorum longus. All right, so the name, break it down. It's going to extend your digits, right? Extend your digits. And it's the longest muscle, so that means that it is long. So this muscle, you can remember as being lateral to our last muscle that we'll talk about after this. So it's going to be lateral. And extensor digitorum, remember, these are all your digits, right, down here. So your feet. All of those little parts right here are your digits. So with the extensor digitorum longus, lateral condyle of the tibia, anterior surface of the fibula. I don't know why they keep spell check, man. Changed everything to fibula. So fibula. So it's going to run down the front of the fibula, right, starting at the lateral condyle of the tibia, and it's going to run down here, and it's going to insert on the superior surface of all your toes. So this is actually what causes extension of your toes. So when you take your toes, so if like you bend them like this and you extend them forward, right, that is your extensor digitorum doing that. So actually when I do this motion with my hand, I'm going to bring it and extend it out. It's the same named muscle, but it's in your hand. Extensor digitorum is part of that in your hand. So its main job is to extend the joints of toes 2 through 5. You actually have a different muscle that runs around this way that goes down your big toe to extend and flex your big toe. You have got a couple muscles there. But extensor digitorum, it's going to do digits 2 through 5. Okay. Last muscle. All right, this is it. This is the last muscle on your table. We are going to be done after this. All right, the first one is the last one is your tibialis anterior. So the tibialis, it's going to run along the tibial bone, and it's going to be on the anterior side of your foot. So your tibialis anterior is the muscle that goes down to your big toe. All right, so it's going to go down to the first metatarsal of your here for your origin. It's going to start in the lateral condyle proximal shaft, insert on the base of the first metatarsal. Okay. So lateral condyle and proximal shaft of tibia. So it starts here on the tibia, runs down the tibia, and then goes down to your big toe. And its main action is dorsiflexion at the ankle and inversion of the foot. So it helps bring your foot towards the inside here. Remember, inversion is you're bringing your foot, so the soles of your feet are going to touch. Eversion is when they go outwards. So you've got different muscles that do that. So dorsiflexion is when it's going to bring it upwards, right? So it's going to have your toes, if they're like this, you're going to point them up. Plantar flexion, again, you're pointing down. So that's different. All right. So tibialis anterior, down the front. Lateral condyle, it's going to come down to the front of your foot. And we'll be able to see this on the cat once we get through the knee and all of the fascia that's around the patella up here. All right. So that is it. That is the last of the muscles that you guys need to know. So I know it was a long and arduous journey going through all of the muscles of the human body. But again, review these videos, look at them over again. All of the muscles that we've talked about up to this point, every single muscle on your table is fair game for your final practical on the human muscles, okay? So you need to know origin, insertion, action, and the name for every single muscle that we've talked about, okay? So lots of studying, review your flashcards, watch these videos over and 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 over again, okay? So you have these available to you to review all of these things. So again, check your tables, make your flashcards, again, study, 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 okay? I can't stress enough that this is not something you can cram for the night before, okay? We've seen how that's worked for you guys so far, and it has not worked well. So if you want to do well on this last test, you need to review starting now, okay? Take the time, take the energy, pull out your flashcards when you've got some downtime, quiz each other. Again, I can't stress enough how important it is for you guys to just go through, memorize, and look at all of these different muscles, because we will look at them again, all right? That will come up again when we start talking about other systems, okay? Okay, so that's it. Good luck studying.